Did you know vitamin A is not only found in carrots? Come on, check it out! Vitamin A is the name of a group of fat-soluble retinoids, primarily retinol and retinol esters. Vitamin A is involved in immune function, cellular communication, growth and development, and male and female reproduction. There are two different sources for vitamin A. First is Preformed vitamin A, which is found in fish, organ meats such as liver, dairy products, and eggs. The second is Provitamin A carotenoids, which are turned into vitamin A by your body. The most common Provitamin A carotenoid in foods is beta-carotene, such as green, orange, and yellow vegetables and fruit. The examples are spinach, carrot, broccoli, winter squash, mango, and apricot. Vitamin A also available in standalone supplements and most multivitamins, often in the form of retinol acetate, retinol palmitate, provitamin A beta-carotene, or a combination. The common amounts of the vitamin A supplement is 3,000 microgram. The amount of vitamin A that you need depends on your age and sex. The average daily recommended amounts of vitamin A are listed in micrograms of retinol activity equivalents, or RAE. In birth to children, it ranges from 300 to 600 micrograms. For teenagers and adults or depending on gender, pregnant women also need 770 micrograms, and this increases when breastfeeding to 1,300 micrograms. What happens if I don't get enough vitamin A? The most common sign of vitamin A deficiency is an eye condition called xerophthalmia. Xerophthalmia is the inability to see in low light, and it can lead to blindness if it isn't treated. Xerophthalmia develops after plasma retinol has been low and the eye's vitamin A reserves have become depleted. Chronic vitamin A deficiency has also been associated with abnormal lung development, respiratory diseases such as pneumonia, and an increased risk of anemia. Can vitamin A be harmful?
Because vitamin A is fat-soluble, the body stores excess amounts, primarily in the liver, and these levels can accumulate. Acute vitamin A toxicity, also referred to as hypervitaminosis A, getting too much Preformed vitamin A, usually from supplements or certain medicines, can cause severe headache, blurred vision, nausea, dizziness, muscle aches, and problems with coordination. Chronic hypervitaminosis A can cause abnormal liver test results. The most common effect of long-term excess beta-carotene is carotenodermia, a harmless condition in which the skin becomes yellow-orange.
Are you one of the following groups at risk of vitamin A deficiency? The first is premature infants. Preterm infants have low liver stores of vitamin A. This condition can cause high risk of eye and chronic lung disease. The second is people with cystic fibrosis that have pancreatic insufficiency, which increases their risk of vitamin A deficiency due to difficulty absorbing fat. The third is individuals with gastrointestinal disorders. And the last is infants, children, pregnant, and lactating persons, especially in low-income and middle-income countries. Vitamin A also has a role in these conditions. In cancer case, some clinical trial evidence suggests that supplemental vitamin A might reduce the risk of certain cancers, but increase the risk of other forms of cancer, cardiovascular disease, morbidity, and mortality. In age-related macular degeneration case, because of the role of oxidative stress in AMD pathophysiology, supplements containing carotenoids with antioxidant functions, such as beta-carotene, lutein, and zeaxanthin, might be useful for preventing or treating this condition. In measles case, the major risk factor for severe measles is insufficiency of vitamin A, and this case mostly occurs in young children in low-income countries that might prevent morbidity and mortality. Thank you, and see you in the next journey.